For me, having my own children taught me such a lot about what it feels like to be a parent. In particular, one of the first things I noticed was that babies make an extraordinary number of noises at night. And I had no idea. They snore, they snuffle, they sound like they're stopping breathing. And all of that is absolutely normal. So that's one of the big things that I learned. You have to put your own oxygen mask on before you put somebody else's on. And that very much applies to when you're a parent supporting your child in hospital. A lot of it's just about keeping the baby upright. You don't have to do too much tapping. It's simply allowing the wind to come all the way up and then be burped upwards. So a baby just with a fever, but who's feeding, drinking, active, alert, who's nice and well hydrated, you're not going to worry about. But a baby with a fever who's whimpering, who's not engaging, who looks grey, who looks clammy, you're going to really worry about. So it's much more about making an assessment of that baby.
Hello and welcome to the Unii podcast with me, your host, Dr. Saranya. Today we are joined by Dr. Sue Laurent, a London-based paediatric consultant with over 3 decades of experience, who has completed a number of baby journeys for Unii. These include baby health, which we're going to be talking about today. Sue has also written several books on child health, including Your Baby Month by Month and Your Premature Baby. So it's fitting that we're devoting part 1 of this podcast with her to answering some of your questions about baby health, as well as some of my own. Let's take a look at Unii's baby health journey.
Baby health is an essential aspect of parenting, as ensuring that your little one is healthy, happy and thriving is a top priority for any caregiver. Babies need a nurturing and supportive environment in which to thrive, and it is essential to provide plenty of love, attention, and positive reinforcement to keep them safe and help them to develop a strong sense of self-esteem and confidence. My name is Dr. Sue Laurent, and I'm a general paediatrician and a published author of several baby books, including parenting guides, Your Baby Month by Month and Your Premature Baby. I've been working as a consultant paediatrician since 1993. In this journey, I'll be taking you through some of the key aspects of baby health that you should be aware of, such as cleanliness, common health issues, and symptoms, and basic baby first aid. I will talk you through when to worry and when you can relax, by staying informed about the best practices in baby health, and by providing a supportive and nurturing environment for your little one, you can help ensure that your baby grows up healthy, happy and thriving.
Welcome, Sue.
Hi, Saranya.
Hello, it's lovely to see you today. So, you've had a fascinating journey with Unii, and I can't wait for our listeners to hear all about your experience and expertise in those episodes. I just wondered, what was your favourite episodes and why?
Well, I suppose the ones I've most enjoyed making are the ones where I feel that my voice is sort of connecting, hopefully, with new parents and saying the sort of things that I say all the time that I would love to have on record so that parents can watch them. So it's really stuff about what happens with normal childbirth, normal children, how do you tell a well child from an ill child, that kind of thing. Those are my favourite episodes.
Yeah, I think that sounds like something I'd enjoy too. So you and I have both been working with babies throughout our careers, and something I get asked a lot is whether I have my own children. I'm always curious to know what sort of answer parents are expecting, but I would love to know from you whether you felt that there was a change in your practice or how it differed when you had your own children.
There is no doubt that for me, that first of all, that you can be a great paediatrician and not have your own children. But that for me, having my own children taught me such a lot about what it feels like to be a parent. And in particular, one of the first things I noticed was that babies make an extraordinary number of noises at night. And I had no idea. They snort, they snuffle, they sometimes think that they sound like they're stopping breathing. And all of that is absolutely normal. So that's one of the big things that I learned.
And I'm sure I will be learning some of those lessons too in the months to come. So what was it that drew you to be a paediatrician in the first place, Sue?
So I always wanted to be a doctor from when I was really tiny. And I always loved children. So when people asked me when I was about 11 or 12, what do you want to be? I always said, I want to be a paediatrician. And I used that word as well. I didn't say children's doctor, I said paediatrician. Something about kind of fun, I think. I loved playing with children. I loved their curiosity, their innocence. And I've never regretted it.
That's a really lovely answer, Sue. And actually, it's interesting that you say that you wanted to be a paediatrician from such a young age, because actually I didn't know I wanted to be a paediatrician until I did my paediatric placement at medical school. And I suddenly realised, wow, this is really fun. And that's also a word that you've used too. It didn't feel like medicine. It felt like, playing with with kids and having a good time, but also making them feel better, which is really rewarding. And actually talking about rewarding experiences, something people say a lot when I say I'm a paediatrician is that must be such a wonderful thing to do. And I just wondered, do you have a particular rewarding case that you remember?
Oh my goodness, there are so many rewarding cases, and you remember them over the years, don't you? And it's often about a child who's very, very sick, who comes into casualty, and you're with the family, and you don't know if you're going to lose them or not, but you keep them alive, and then they come back and they meet you again, and you see the child looking completely different and skipping in. I mean, I've had many, many experiences like that. But also equally, just small moments when you just explain something to a family that they didn't understand and they were so fearful about. And just by explaining, you can change everything for them.
Yeah, I completely agree with you. I think for me, those are the real rewarding moments when you help clarify some uncertainty in a family. So in your journeys, you've talked about common illnesses that affect children. Are there any specific ones that you wish there was more information for parents?
I have to say constipation, and you're nodding.
I am.
Because it sort of infiltrates all of our work. It's a common cause for children, toddlers, to come up to A&E because people think they've got appendicitis. And it's a common thing which needs real careful explanation and a real careful treatment plan. And only yesterday I saw a child who'd been suffering for 18 months because the parents really didn't know how to treat it. And I just feel if there was more out there, that it would be so much more helpful for families.
Yeah, I agree. And of course, that's a big part of our role in filling in those gaps and providing families with the support to be able to carry on managing those conditions at home. Something that I get asked about a lot, as I'm sure you do, and something we found at uni is that a common concern for parents is about the normal temperature of a newborn. Can you tell us what sort of things parents should be looking out for?
So yes, I mean, if a newborn should have a temperature which is around 37 degrees centigrade. So it's definitely worth having a thermometer, although I have to confess that I didn't own a thermometer until COVID, when I realized I should take my own temperature, and I had to go and buy one. But parents should, because actually babies can get cold, so it's worth knowing that they're kept warm enough, especially newborn babies. But also, if a baby has an actual temperature, so a temperature of sort of 38 or above, you ought to, in the first 3 months of life particularly, be seeking medical advice.
Thank you. That's really helpful. Something else I see a lot in practice is skin conditions like eczema. And there's lots of chronic conditions out there. And of course, they can be quite distressing for both baby and parents. And I just wondered, how do you support families in those instances where they're not able to communicate with small babies who haven't yet developed language?
I think you've picked on something which is such a common problem and so difficult to treat well. It's easy to treat acutely. In other words, it's easy to put lots of cream on and solve the immediate problem. But the difficulty is it's a long-term problem. And it's about what our role is to make sure that families really understand that ongoing treatment is very, very important. And even when the skin is looking great, the treatment's got to continue because there's an underlying genetic problem very often with eczema. And that's so frustrating for families. Sometimes in the clinic, I will actually apply all the cream over a child's body to show a family what we mean in terms of how much cream is needed.
And how about not just in terms of eczema, for other conditions? How can parents feel empowered to, support their children when they can't communicate with them?
That's a very good point. Well, I think sort of recognizing in your child's body language, in fact, your baby can communicate with you from the very beginning. And that's the fascinating thing about babies. So we can tell when they're worried or in pain by their body language. So I think it's important for parents to really follow their own instinct as well. Because I think as a parent, you have a natural instinct to know when your baby's in distress. So sit with your own instinct is what I would say.
And I think that's really important advice. Something I often say to the parents that I see is, I've met your baby for 5 minutes, and even though they're only a month old, you've known them for that whole month, every hour and every minute of their life. And that's really important. And parental concern is something I take very seriously too because of that.
Yes.
In paediatrics, unlike in adult medicine, something we often do is measure a child's height and weight, because we know that in some chronic conditions, these things can start to reduce, and we want to make sure that that's not happening. But there are also some psychological effects which may be apparent long-term in children with these chronic conditions. Do we know about any of those?
Yes, and in fact, nowadays I would say that most paediatric departments will have a team working within them. They call the paediatric liaison team, which actually is a mental health team working alongside doctors. And it's very clear that children living with chronic diseases such as severe eczema, such as diabetes, such as epilepsy, suffer much, much higher rates of mental illness, of anxiety, depression, missing school, and addressing those things and helping support children and families with how to deal with them is very, very important.
And I suppose that's why we've got psychologists available in lots of our teams as well, to make sure we address all of those things as part of the multidisciplinary team.
Exactly. So a big diabetes team will almost always nowadays have a psychologist as part of it.
Let's talk about childhood vaccinations, also known as immunisations or shots. Something we always ask as paediatricians is whether a baby's immunisations are up to date. And in some cases, we come across babies who haven't had all of their immunisations or none at all. And all of us broach this situation very differently when we come to counsel families. I just wondered, what's your usual strategy for this?
Well, I think I go through waves of this. So when I was a junior doctor, I thought I'd be able to convince all parents to breastfeed, all mothers to breastfeed, and all parents to have their child fully immunised. And I was on an absolute campaign, and I would be very disappointed if I failed. It's still my campaign. And I still do always ask about immunisations. And I then ask, would you like to have a conversation about them if a family says, I don't want to have them? But I have realised now that sometimes you're just on a completely losing wicket, and often we just don't have enough time to go into it all. I sometimes point people towards really helpful websites and also point out that there's some very unhelpful, wrong websites out there.
Okay, that's very interesting to note. And being in hospital, of course, can be a very stressful time for both babies and for parents. And what would you advise parents as some top tips for being able to support themselves and their babies through this time?
So we often say this. We say you have to put your own oxygen mask on before you put somebody else's on. And that very much applies to when you're a parent supporting your child in hospital. So, as you know, we very much encourage families to stay in with their children. But one of the things I would say is, if you are lucky enough for there to be two parents in the family, share that job out. Don't have it as the same parent saying this is a long-term stay in hospital. Bring in for your child anything that will make them feel happy, familiar, their own duvet, their toys, whatever it is that will make them feel comfortable. If there's any particular food that they like that we might not be able to provide in the hospital, bring that in as well. And for yourself, do get rest, do eat, do go and get some fresh air. Sometimes people get real cabin fever by being stuck in a hospital. We often have beds for parents to sleep on, but not always. Some hospitals just have chairs for sleeping on. And, you can't do that for night after night.
So what you're saying is it's really important to make that hospital environment as comfortable and perhaps mimic characteristics of the home as much as possible to make
Completely.
the child and the families comfortable. And is there any evidence that if the parent is perhaps stressed or worried that may project onto the child and their recovery?
100%. Anxiety is very contagious. And so if we as doctors and nurses support families, parents well, they in turn can be much better at supporting their children.
And something I know you've talked about when a baby is in hospital is writing a diary about that experience. Is that something that you did yourself?
No. But I think on the neonatal unit, particularly, it can be really helpful because on the neonatal unit, you're just there looking at your baby. Very often they're behind perspex in a closed incubator and you're wondering what to do. And sometimes writing a diary, maybe for the baby in the future about what their life was like to begin with, or maybe for your family or for yourself, can be a really constructive thing to do and help show progress. On a children's ward, I'm not sure. I think parents are much busier on children's wards, so there probably isn't so much time to diary keep there.
Okay, so something I definitely see a lot in the paediatric emergency department is head injuries, probably tied with fever. And we can both agree that head injuries can actually look quite dramatic in babies. We describe it as an egg on the head when a baby comes in with a large swelling. Thankfully, most of the time it goes down quite quickly, but it can be quite a frightening experience. Now, some babies and children use this as a self-soothing method, head banging. And I wondered, what was your advice for parents of children who do this, in particular about when they should worry about it?
So there certainly are some babies who headbang, and it can be really scary. They very rarely significantly injure themselves if they headbang. So the ones when you're talking about the egg on head, that's normally a baby that's fallen or a child that's fallen. It's not usually a baby who's headbang. And very often babies and children will carry on doing behaviours that draw attention to themselves, particularly if that behaviour worries us as parents. So one of the best things you can do is to ignore them or simply to scoop them up and give them a cuddle so they stop banging. But head banging rarely carries on for a very long time. So a lot of reassurance is probably the best approach for parents.
In my role as a doctor in the paediatric emergency department, I'm a frequent contact for children that have maybe ingested foreign bodies or have put things in their ears or noses. Obviously, we want to encourage babies to explore their environment, but have you got any particular safety precautions that should go with that?
Absolutely. I mean, between the two of us, we have probably seen so many injuries that happen at home, which happen in a moment. So one of the first things I always say to parents is when you're changing your baby, there will come a moment when they will roll, and it's probably going to be sooner than you think. So always keep your baby attended to on a changing mat or on a bed, even if you think they can't roll. Next thing is stair gates. Children, my eldest son fell downstairs 5 times in total, I'm embarrassed to say, despite having stair gates because they were open at the time. It was always when I was actually on call and wasn't there, funnily enough. So, yes, I wouldn't let that happen again. And also hot drinks on surfaces that toddlers can reach. I've seen so many horrible burns where a child has reached up and grabbed a hot drink.
Yeah, as have I. And you mentioned in your journey about some medications looking like foods or other household objects. Do you know of any other possibly dangerous objects that can look like benign things that we should be aware of?
Well, I think we have to just remember that toddlers particularly are very curious. So they, as you said, they will put things in anywhere. They will swallow things. One of the worst, I think, is mercury batteries, because mercury batteries can leak out. And also there's some bracelets which are magnetized together. And I've seen a few of those where the magnets attract each other inside the child's intestine and can be extremely dangerous.
Okay, that's good to note. So as I'm in my 3rd trimester now, and I'm thinking about my baby coming quite soon, I know that there's lots of nappy changing on my horizon. Now, I'm sure this is something you've come across a lot, but what are the most common concerns regarding nappies that you are contacted about? And what would you like every mum to know?
Okay, so concerns about nappies, I suppose nappy rash. And the good news is that actually with today's modern nappies, they are very, very absorbent. And therefore the skin is kept pretty much dry. And I would say I see far less nappy rash now than we used to. So that's a reassurance. And in fact, if you put too much cream on your baby's bottom, you will make the nappy less absorbent. So there's a balance to be had. And I suppose the other question about nappies is what sort of nappy to use. A massive number of nappies are going into landfill every day, and that really worries me. And there are alternatives, so reusable nappies, which you either wash yourself and you take a lining out, just throw the lining away, but you wash the nappies, or there are nappy services that will collect and wash your nappies for you. And somehow that feels much more ecological to me.
Yeah, me too. I think we're in a society where we're a lot more conscious about, protecting our environment and the planet. And I think it's important to note the significant impact that things like disposable nappies can also have on that. Something which most people feel is an essential item.
And also, I think parents worry an awful lot about changing nappies at the slightest wee. So if a nappy's a bit wet, just leave it because it's really absorbent. I used to change my kids' nappies when I could literally see the poo about to run down their legs. And that's the point. And none of my children ever had nappy rashes.
Okay, so that's good to know. So perhaps our threshold can be increased for changing nappies. I think there's always a worry that if you leave your child in a nappy that's perhaps been wet for some hours or even the slightest bit wet, as you say, that you may be judged by others.
I think there is. And everyone will find their way. But I think don't be too anxious to keep changing nappies. Just wait till it's a bit full.
And of course, there's a reason why the marketing tells you how absorbent they are and how much liquid they can take and for how many hours. So
exactly,
we can stick to that.
Exactly.
And whilst we're talking about cleanliness, and you did an episode for us, How Clean is Too Clean, you discussed 2 different schools of thought about germ exposure. What's your personal view on this?
My personal view is that your household should ideally be a reasonably clean environment. You should wash your hands after you've handled dirty things, and you should wash your hands before you're going to feed your baby. But generally, I think people can get too obsessed with cleanliness. And one of the things that I advocate, and which is very much an American model and far less the UK, is you do not need to sterilise any bottles at all. You just need them to be clean. So if you're lucky enough to have a dishwasher, just pop them in a dishwasher, and that is perfect. And if not, you should just wash them in hot soapy water and leave them to dry and drain. And that is good enough for babies.
That sounds like some really valuable advice, Sue, and something I'm hoping
you can follow that
to
same
follow,
advice.
definitely.
Yeah, because we are obsessed in the UK with sterilising everything. And nipples are not sterile, as I tell people an awful lot when you're breastfeeding.
Very interesting to note.
Mm.
So something I get asked a lot by both friends, family, and of course, patients and their families in hospital is trapped wind.
Mm.
And you've discussed in your journey about different ways to burp a baby. Is there a particular way that you prefer or that you use with your own children?
I think you have to see what comes naturally. A lot of it's just about keeping the baby upright. You don't have to do too much tapping. It's simply allowing the wind to come all the way up and then be burped upwards. But some babies just don't burp much. And if they don't, you don't have to wait for hours. You'll work out your own baby.
And that's exactly what I was going to ask you next. Sometimes babies don't burp immediately and you're waiting for, half an hour to an hour wondering when they might do that. And then it's time for their nap, say. Is that okay to put them to sleep without having burped?
Yeah, absolutely, yes. Because if they haven't burped fairly soon, they're probably not going to burp.
In your journey with us, you recommended that parents use their own judgment about bathing frequency. What did you do with your own children?
I think to begin with, I remember there's that kind of first bath, isn't there, when you have a newborn? Well, you'll discover this when you have your newborns at some point, but not too soon. And then after that, you don't need to really bath them very often for quite a few weeks. You're just sort of top and tailing them and putting a bit of cream on them and not exposing them to too much water. And then after a while, it's kind of personal choice. So one of the bits of advice that I do give is to not worry about buying a baby bath, because early on you can just use a washing up bowl for a little baby, and then later you can just pop the baby in the bath with you. It's a really nice thing to get in a bath and have your baby in there with you and have them splashing about with you. And in fact, a baby bath is an enormous thing that takes up lots of space.
So actually that's not essential at all. Okay. And something else you discuss is baby massage. Again, is that something that you used with your own children?
I went to one class, all the babies cried, and I never went again.
So no is the answer to that. And why is there such a drive to...
I think it's about doing things with your baby. Because to be frank, when your baby's born, they don't do very much. And I think it's kind of fun to go somewhere with your baby and do something with other people. So it might be meeting your friends for coffee, or it might be when they're a little bit older, going to a park. But when they're babies, you can do yoga, but your baby really does interrupt your yoga, I can tell you from me. And so a baby massage is quite a nice thing to do to a baby. Bit of music with a baby is also nice. It's a way of meeting people.
And of course, you highlight some of the key considerations parents should look out for, because you have to be careful when you are massaging a small baby.
Yes. Yes.
And I thought those tips that you suggested on your uni journey were really helpful.
Thank you.
So in terms of bathing, how do you advise families of a baby who particularly doesn't like being in the water?
Don't make an awful thing about it, I think. So, I mean, your child only needs washing every few days. Particularly, it's not really till they reach their teens and they, they go into puberty and you get adult body odor that you really need to think much more about cleanliness. But early on, it's more to do with hands, mouth, feet, bottom. So just do whatever fits in with your family.
So really what you're saying is it's the exposed areas in the beginning
Yes.
that you need to think about. And actually
Yes.
the bottom is usually covered quite well
Yeah.
because we're cleaning that.
And you're changing
multiple
nappies all the
times a
time.
day.
Exactly.
Yeah.
Exactly.
So one thing that you and I will have heard a lot and talk about a lot is crying. So I don't know if you feel the same, but I'm sure you do. You develop a bit of a sixth sense as a paediatrician to differentiate between the different causes of crying. Now, I can particularly distinguish between the baby who is distressed and perhaps the baby that isn't. Have you noticed an ability to distinguish that kind of cry beyond that?
I think I'm a baby whisperer. So when babies come into A&E crying and crying and crying, or come into my clinic crying and crying, I think what they really want, most of them, is somebody to look them straight in the face and talk to them, however small they are. And very often they will be mesmerized by just the fact that I'm paying them a huge amount of attention and I'm talking just to them. And I think the reason the problem escalates is that if you're parents and your baby is crying and crying, what you're doing is you're jiggling them around an awful lot. You're walking them with their face often facing away from you, and you're doing anything you can to try and calm them down. And your body language is tense, and the whole thing spirals out of control. Yes, there are babies who come in crying, but they often, if they really are in pain, it can be more of a whimpering cry, or more of a really high-pitched cry. They're the ones that I worry about.
So we found another superpower of yours. So I'm sure we all remember that flight with the crying baby. Now, unfortunately, most passengers aren't very forgiving when you've got a crying baby on a plane. And I wondered if you had any advice to prepare parents for having babies on a flight.
I was about to say drugs, but I'm not going to say that. I think it is when you're going up and you're going down, so there are pressure differences, it's really helpful for the baby to be swallowing, because if they swallow, they're likely to clear their middle ears and therefore not get that pain that you get in your middle ear with pressure differences. So that's the first tip. And the second tip, I suppose, is to hopefully travel with someone else and share out the burden. I've travelled as a single parent with a tiny baby across the Atlantic. And I remember that being really tough because just the burden fell entirely on me for that flight. So try and share the load.
That's really good advice. And also, I guess, as adults, we often pop our ears in the same way. So that's what you were saying.
Yes.
To get
Yes.
babies to swallow
Yes.
to achieve the same thing.
Exactly. Yeah.
Clever. And so we've talked about what a normal temperature is and when a temperature is considered abnormal. But something I'm often asked or told is that my baby's temperature was a certain number and that really made me worry. Is there a difference in the severity of a fever based on how high it is?
That's a very good question. And in very, very young babies, the answer is potentially, because a very young baby with any fever, you're going to want to have at least have a doctor look at, and you may want to have some tests done for that baby. But as a baby gets a little bit older, it's not the actual temperature that matters at all. It is how unwell they are. So a baby just with a fever, but who's feeding, drinking, active, alert, who's nice and well hydrated, you're not going to worry about. But a baby with a fever who's whimpering, who's not engaging, who looks grey, who looks clammy, you're going to really worry about. So it's much more about making an assessment of that baby.
And I'm glad you said that, Sue, because something I say to my parents a lot is treat the baby, not the temperature, because it is all about the whole picture.
Exactly.
And when we're talking about those times where we do treat the temperature, what sort of things would you advise?
So most parents have probably heard about paracetamol, ibuprofen. You can get that for babies and young children. That will often help a lot with bringing temperature down. Also, don't overwrap your baby. So we have a tendency, if a baby's got a fever sometimes, to keep them extra warm and overwrap. But actually what you want to be doing is to take off a couple of layers. So just leave one layer on them. And if your room is very stuffy, open a window.
I think that can be quite difficult sometimes when you've got a baby that might be shivering because they've got a temperature. And naturally we think shivering is associated with feeling cold, so you put on more layers. But actually that's important to note that you still need to get that temperature down, and being comfortable with having less layers on is okay.
Very important.
And something we're all familiar with is a little bit of vomit with babies, especially after a feed. And I think we're quite comfortable with a bit of spit up. But beyond that, when should parents worry about a baby who's vomiting?
So yes, so if a baby's vomiting so much that they're not gaining weight, that's a worry. If a baby's vomiting more and more, particularly at around the age of 4 to 6 weeks, that can also be very worrying, because there can be something that's actually stopping the milk go through. And also I would say that if a baby's vomiting and they seem unwell, limp, lifeless, not interested in feeds, that I'd be worried about as well.
And what about what the vomit actually looks like?
Very good question. So most vomit is going to be, in a baby, is going to be milk, or sometimes sort of saliva if it's quite a while after food. But you should worry about a baby, a young baby, if they're vomiting yellowy liquid, because that's bile. And in a young baby, that can indicate something serious going on.
So if it's okay with you, we'll be asking you a few questions, and then I want you to answer them as quickly as you can.
Okay.
So first question, do you have a hidden talent?
I thought about this for a little bit, and then I thought, well, maybe it's the fact that I can really accurately tell a baby's temperature just from putting my hand on the back of their neck.
Wow,
I don't need a thermometer.
You'll have to teach me that one. And if you had a superpower, what would it be?
Well, I've always loved the idea on Star Trek of when they come in with a device that goes up and down the body and says that's what's wrong with the person, and then they go up and down again, and then they just make the person better. And I would love to just be able to lay my hands on a child and say, I'm sure about what's wrong with you, and I'm now going to make you better.
That's a great skill to have. What is your feel-good anthem that lifts you up when you're feeling down?
Well, funnily enough, it's always been Bridge Over Troubled Water by Simon and Garfunkel. I just love that, and I love the words.
Yeah, it's a beautiful song as well. Okay, we're going to do a rapid fire round now. So 2 options, and I want you to answer them as quickly as possible. So, coffee or tea?
Coffee.
Dine in or dine out?
Dine in with loads of friends.
Singing or dancing?
Both.
And favourite ice cream flavour?
I'm just not that mad about ice cream,
okay,
actually.
Favourite pizza topping?
Oh, pizza topping, it's got to have anchovies and lots of veg.
Okay, good choice. And if you had to describe yourself in 3 words, what would they be?
Oh, it's a difficult one. I think I'm a can-do person. I think I've got loads of energy, and I think I'm also pretty supportive.
I'm going to agree with all of those. Sue, I'm afraid that's all we have time for, but thank you so much for joining us. We've learnt so much from you in this podcast.
Thanks very much.
Please join us for part 2, where we'll discuss Sue's baby development journey with Unii and your baby's first year of life.